To be joined by Dr. Chrystal Shand. She's a pediatrician with the Washington chapter of the American Academy of Pediatrics. Educating people about the dangers of vaping has really been one of your missions. And we've been talking about this. What is going on with this current outbreak? Because people have been vaping for years now, but now we're seeing these vaping-related deaths.
Yes, and the CDC investigation is ongoing to try to find out the root cause of this. But all of the cases so far have been people who've been vaping within the past 90 days who've then suffered severe lung injury. And none of these cases have been seen to be caused by infection or other health causes.
Is there a specific product or vaping substance that they know is to blame at this time?
No specific product has been identified yet. In some of the cases from Wisconsin and Illinois, some are using THC, some are using nicotine only. There's not one specific product that we can target as being, this is the problem.
And we have 3 cases here in the state of Washington, one
Yes.
in King County, which involves somebody from the age of 10 to 19, and then 2 cases east of the mountains with ages anywhere between 10 and 29. So these are young people.
Yes, these are pretty young people, and some of the cases that we've seen in Wisconsin and Illinois from one of the published medical reports, these are mostly healthy people who didn't have other underlying lung illnesses or other things going on with them.
So what kind of illnesses are we seeing? Is this one illness? Is this a handful of illnesses?
Based off the CDC case definition, this is what they use for surveillance.
Yeah.
All of the people who have been cases have had vaping within the past 90 days. They have findings on chest imaging, like x-rays or CTs, and they've had negative infectious workup, or infection hasn't been thought to be the primary reason for their lung injury.
So these aren't people that potentially were vaping for years and all of a sudden it caught up to them. This is something that's going on currently with a product.
It could be, yes.
Okay, so let's talk about what parents and grandparents can do, because unlike smoking, if your kid was smoking, you'd probably smell it, right? It was a key indicator. Often vaping products are odorless. So if I'm a parent or grandparent, how do I know if my kids are using this?
Talk to them. I encourage open communication with parents and teens, and because a lot of vaping equipment is so hard to detect, some of them look like USB keys, the smoke, there is no smoke, there's no really a big odor that you can sort of detect. I encourage the open communication, and I think with all this recent information out there, it's scary to me as a doctor, and I think it'd be scary to parents, so I would really encourage open discussion and communication.
If someone is vaping now and they become really concerned because they read about this news, they hear about this news, what should they do to quit?
I would suggest calling the Washington State Quit line. You can call 1-800-QUIT-NOW, and I would also suggest talking with their doctor.
Okay, going back to smoking clearly is not the best option, right? We know smoking will kill you as well long term.
Yeah, cigarettes have been around for decades, and they've been much more well researched. Cigarettes are known to be harmful, and vaping is not safe, and now we're seeing the harms firsthand.
I want to go to some viewer questions, and most online, I thought this was super interesting, that they are defending vaping, saying cigarettes kill way more people every year than vaping. 480,000 people die from cigarettes per year. So are cigarettes more dangerous than vaping?
Cigarettes have just been around a lot longer, so we can see all their health harms. I agree that cigarettes are deadly and dangerous, and I don't think anybody should smoke cigarettes, but I don't think vaping is a good solution.
We don't know if it's better for you long term. Is that the simple answer?
Yeah, we know that vaping is harmful, we just don't know the full extent of all the harms quite yet. And we've seen e-cigarettes out on the market for the past few years, and we knew that there's lots of chemicals in them that aren't well regulated that could cause lung injury, and now we're seeing deaths from it.
There was one person who asked, is there any vape product on the market that is not bad for you? Do we know?
We don't know, and I don't think we can safely say that. None of the vaping products have been tested for safety. None have been tested for effective smoking cessation. So right now they're just a product, and it's not just harmless water vapor. These things have chemicals in them that can be really bad for you.
And if anybody out there is vaping, they feel like they don't feel 100%, what should they do?
Call your doctor and seek medical care.
All right, Dr. Shand, thank you so much for being here. Thank you for the insight.